Welcome to WeLearn, Virtual Learning Network. This is session number 21, Family Planning Methods and Spacing Between Live Births. Topics which we are going to cover in this session are Introduction, Family Planning Methods, Spacing Between Live Births, Religious Views and Spiritual Guidance, Preference for Male Child. Moving towards the first topic, that is the introduction. Since there can be side effects of using family planning methods, one must always seek the opinion of a qualified physician before deciding to use any of the methods. Above all, the husband and wife should seriously consider the issues and acquire accurate knowledge on the subject. Since some religions have reservation on the use of family planning methods, the couple should also seek necessary spiritual guidance. Coming towards the topic family planning methods. What are the different methods which we can use for family planning? Family planning methods or contraceptive methods by definition are preventive methods to help couples to avoid unwanted pregnancy. There are a number of methods which are commonly used by the people. Number one is condom. Condom is the most widely used barrier device by the males around the world. In India, it is known by its trade name Nirod, a Sanskrit word meaning prevention. Next is diaphragm. The diaphragm is a virginal barrier. It is a shallow cap made of synthetic rubber or plastic material. It has a flexible rim made of spring or metal. It is important that a woman be fitted with a diaphragm of the proper size. The diaphragm is inserted before sexual intercourse and must remain in place for not less than 6 hours after sexual intercourse. Next is intrauterine device. The IUD are devices used for the control of contraception by introducing a foreign body into the uterus. There are two basic types of IUDs, non-medicated and medicated. Both are usually made of polyethylene or other polymers. Hormonal contraceptives. Hormonal contraceptives, when properly used, are the most effective spacing methods of contraception. They provide the best means of ensuring spacing between one childbirth and another. These are oral pills, combined pills, progestin, that is only pills, post-coital pills, once a month pill, male pill. Next is the deposit or slow release formulation. These are injections, subcutaneous implants, vaginal rings. Next are the post-conceptional methods. Under this, number one is menstrual regulation. It consists of aspiration of the uterine contents for 6 to 14 days of missed period, but before, most pregnancy tests can actually determine whether or not woman is pregnant. Number two, abortion. Abortion is the theoretically defined as terminated of pregnancy before the fetus become viable. This has been fixed administratively at 28 weeks. Other methods of family planning. These are abstinence. The only method of birth control which is completely effective is complete sexual abstinence. It is sound in theory. In practice, it amounts to repression of the natural force and is liable to manifest itself in other directions such as temperamental changes and even nervous breakdown. Next is the coitus interrupts. This is the oldest method of voluntary fertility control. It involves no cost or appliance. In this method, the male withdraws before ejaculation and thereby tries to prevent deposition of semen into the vagina. Next is the safe period rhythm method. This is also known as calendar method. This method is based on the fact that ovulation occurs from 12 to 16 days before the onset of menstruation. Next is the spacing between live births. Spacing is the interval between two live births. There are a number of social and cultural factors which have tended to increase the spacing between two births. The segregation of women after delivery, the taboo of sex relation when the child is young, and abstinence on certain religious days are some of them. Next is prolonged lactation, which has been observed may also be an important factor. The Hindu joint family has also helped in minimizing the frequency of sexual relationship. When increased education, urbanization and economic prosperity, social atmosphere is changing. Widow remarriage is becoming more common. Moral resistance is not much observed, and the joint family system is giving way to nuclear families. All these factors affect spacing. The birth of child is a voluntary decision of the couples rather than a culturally oriented phenomenon. Next are the religious views and spiritual guidance. The teachings and traditions of the important religions have been the conscience keeper of the world. The ethical views of different religions have always condemned the violation of natural law. According to Hindu Vedas, abortion is considered to be more serious sin than killing of a Brahmin. Based on the Shastras and on the principle that the genetic components are complete at conception, the modern Hindu belief is that life begins with conception. Though Hindu ethics condemn absorption generally, it accepts abortion on the grounds of rape, incest, and when the mother is at the risk of grave injury or death. This is because Hindu ethic places greater weight on the maternal rights rather than on the unborn child's right. The basic teaching of Islam is that life is a gift of God. Hence the Quran warns men not to interfere with the work of God. It is on this faith that Muslims generally oppose abortion. The laws of Islam prohibit abortion since the fetus is considered a living being. But as per the doctors, fetus is only a human being after the 4th month. Hence, abortion is allowed in general during the first 90 days of pregnancy and it is prohibited immediately afterwards. The Christian religion also condemns abortion. Christianity encourages couples to have self-control and promote natural family planning methods. Christianity considers abortion a grave sin and calls it murder. At this time of conception, a new life has started and abortion is the killing of that new life. The Holy Bible warns empathetically against abortion at any stage of the conception. Next topic is the preference for the male child. In India, sons are important from a religious point of view. According to Hindu religion, a man attains salvation only when a son performs certain rites at his funeral. Preference for a son is not only a religious point of view. Sons are considered as providers of security in old age and during prolonged illness. Once married, the girls are considered to belonging to their husband's family and therefore They cannot be relied on the support in old age. The reason for the importance of sons in Indian culture are: number 1, sons are required to perform the last funeral rites for their parents. It is interesting to note that in Sanskrit, Put means hell and Putra means literally one that saves from hell. Son, upon marriage, attract dowries from the parents. Son, provide economic and emotional security in old age. It is the son, not the daughter, who remains at the parents' home after marriage. Next is, son provide income and help in the house and in the field from an early age. Son bring prestige and local political powers to the household, the kinship group and caste. The question of son supervisorship is therefore so vital that people do not feel satisfied with just one son. They seek safety in numbers. Women who have compelled reasons for desiring children, preferably sons. The most intense hope of a young woman is that she proves her worth to her husband's family by producing a healthy male child. The birth of a son entitles a woman to the respect and status. She and her baby have been conditioned to see their success and destiny in terms of procreation, especially of son. Now in the last, there are few questions which are based on this session. Discuss the objective and scope of family planning services. And question number 2 is, what is abortion? What are the different types of it? That's all for this session. Thank you. Happy learning. We learning.